Well, I'm pleased to welcome to our studio this morning John Mackey, co-founder and CEO of Whole Foods. Thank you so much for talking with us.
Thanks for having me, Mabel.
Well, you made a fantastic presentation really talking about health habits throughout the United States. You really began with talking about eating habits in the South. What are you finding there that is concerning to you?
If you look at the trends, not just in the South, but all across the nation, we've seen our obesity rate double in the last 30 years. And we've seen it on a state-by-state basis where obesity is higher in the South, but it's just a few years ahead of the rest of the country. The rest of the country is following in lockstep. And with obesity comes a whole host of other diseases, from diabetes, increased risk of heart disease, increased risk of cancer, gallstones, kidney issues, liver diseases. There's all of these correlate with obesity.
Mm-hmm. And you also have written extensively on what you think the healthcare system needs to look like. And you cite your company as an example by really offering health savings accounts, high deductible health insurance plans. Are these options that are realistic for other companies to offer?
I not only think they're realistic, I think they will be. I think more companies are going to adopt things that Whole Foods is doing simply because they work. And in capitalism, if something works, if it lowers costs, and it's proven, it becomes widely adopted.
Well, tell me how it works. How do you know they work?
I can see it. I know we are documenting it. We will publish our results. And we're seeing from our discount card program, from our total health immersions, we're seeing hundreds, and now I'm beginning to get into the thousands of team members make lifestyle changes. We've seen dozens and dozens of people lose over 100 pounds of weight in less than a year. We're seeing people quit smoking. We're seeing people eat healthier diets. And as a result, they're becoming healthier, and that will drive down in the long term the healthcare cost.
There's been a lot of discussion about engagement. You can offer these programs, but how can you get people to really take advantage of them? Are you seeing any sort of challenge in doing that at your company?
Well, we create incentives. I'm a believer in the carrot versus the stick, more or less, in terms of motivating people. For example, we measure objectively whether people smoke, their body mass index ratio, their cholesterol, and their blood pressure. And if they hit certain objective criteria on those, then they get a bigger food discount. If you get 20% discount if you work for the company, but you can go up to 30% based on these objective health criteria. And people naturally want to get a higher discount. And it's sort of a game. It's a badge of honor. If, for example, the highest level is platinum, and if you can get a platinum card, that's kind of a prestige card. You like to show that at the register. It's sort of a badge that you're healthy.
Okay.
So that's a very strong incentive. Also, for our sickest team members, those who have diabetes, who have heart disease, who are obese, or at very high risk of having those diseases, we allow them at our expense to go to what we call a total health immersion, a 1-week retreat under supervised medical care to do intensive education, intensive dietary shifts, and the results of that program has been simply phenomenal.
Right.
We've seen so many people help. We've had over 1,200 people go through that program in the last year and a half.
And these are available to full-time employees, of which there are 89%?
They don't have to be full-time.
Okay.
They work for us, then they're eligible for the program.
Are you finding that you may shift to something even more aggressive, like, say, what the Cleveland Clinic Foundation has done, where they say we will not hire smokers? Is that something you support?
I admire them for doing that. It's something we've talked about internally, but we haven't yet. Whole Foods' percentage of smokers probably mirrors the culture overall. It's not. I don't think we have any better track record there. Mm-hmm. And I admire them for doing that, and I would like to think someday we'll do that too. We're not quite ready to do it yet.
Sure. Why is it so difficult for people to really change their eating habits? Because you do say you have employees who suffer
Mm-hmm.
from diabetes.
I really think that I think food addiction is much greater than we realize. We don't really take that seriously. We do take smoking as an addiction seriously. We see alcoholism. We tend to think food is more innocent. And yet, you don't really understand your food addictions until you try to change the way you eat. And then the food addictions begin to assert themselves. We are addicted in America to sugar, fat, and salt, and possibly high inputs of animal protein as well. So it's very difficult for people to shift away from that, and you won't really know that until you try to do it yourself.
Do you find that people are more open to the education about this, and is that education really helping people change their attitudes?
I think they are open to it, but it is difficult to shift, and that's why I've created incentives to do it, and why we have our total health immersions, so that our team members can go into a retreat-like setting and experience the benefits of the shift over a 1-week period. When you see the benefits and you see your cholesterol drops 40 points, your blood pressure drops 20 to 30 points, you drop 10 pounds of weight in a week, that's very reinforcing. And that encourages people to want to stick with it.
Are you taking very many meetings with payer and provider communities who want to know more about what you're doing and what your thoughts are for what healthcare should look like?
That's the risk you take when you come to a conference like this, is everybody wants to come study what you're doing.
Which seems like a good thing.
Yeah, but it takes a lot of our company's time, and we're busy doing our own stuff. So that's why we're trying to document it scientifically so we can publish it in journals and whatnot. So we do want to communicate, but we're still in the very early stages ourselves. So it'll be a lot more substantive data in the next 4 or 5 years that could have an impact on people.
You wrote a very compelling article for the Wall Street Journal a couple of years ago. What is your message here today, now that we're fully a year into reform?
Well, the healthcare reform that we did, it's really all about who's going to pay for healthcare. And it didn't address, the reforms that we got didn't address, it really didn't address lifestyle changes. It didn't address cost controls in any type of way. It was just extending access, so to speak, to health care. And so all the suggestions that I made in my op-ed piece in the Wall Street Journal, none of them have been implemented. And I think every one of those suggestions I make would really make a difference if they were implemented. So I guess I would say I was disappointed in what we got.
Yeah, and so do you think that people are just missing the boat here?
I don't...
or in terms of just really taking a look at these high deductible health insurance plans and seeing how they could work within their own walls.
You know, my favorite example of another nation's health care that if I was to say America should look at, should take a close look at what they do in Switzerland. Okay. In Switzerland, they have universal health care, they have an individual health mandate, you have to have insurance, but then they allow the markets to work. It's a highly competitive system, and these lots of different insurance companies competing. And what they do to ensure universal access is that they take the people who are poorest and then they give them a sense of voucher based on their income level so they can have the money to purchase private health insurance. And what's interesting is in Switzerland, where you give people a choice in a competitive market, 60% of the Swiss choose a high deductible plan. Given a choice, that's what they choose. And I think Americans would as well if that was a widespread choice was available. And we could have universal health care if the government would do it in this way of not putting them into government programs like Medicaid, but in a private, competitive private insurance industry, competing across state lines, and supplemented the poor people so they could purchase private health insurance. I do believe that would be a reform that would really work well in America.
Okay. John Mackey, thank you so much for your time today.
Thanks, Mabel.
I'm Mabel Jong. You're watching coverage of the 8th Annual World Healthcare Congress in Washington, D.C.